So, ProPublica did a study of mental health patients and when they go to medical facilities. It's actually a protection under the law. There is a law called the Emergency Medical Treatment and Labor Act, known as EMTALA. Law enacted in 1986 requires hospitals to screen and stabilize all emergency patients regardless of whether they have insurance. They're finding that people with mental health disorders, people who are suicidal, people who are a threat to others, are not getting treated. They're getting released really quickly, and it's leading to people losing their lives. Yep, you heard that right. The law's not being enforced. I've already talked about the insurance companies. Not many of y'all actually paid attention to that video, but I don't care. I'm going to cover this. Hospitals are supposed to bring these people in, make sure that they're safe, or make sure that they're not a threat to others or themselves, and are safe before letting them go. But they're not doing that. But I'm going to read you off. I'm going to have a link down below for this ProPublica article. Also, if you don't mind, hit like and subscribe. This is government not doing its job, and I tell this kind of story all the time. So let's get into it.
Howdy, y'all. This is Paul, the Redneck Thinker. What we have here is a channel to communicate. I want you folks to be thinking by the time you leave my videos. Why? Because I'm tired of people talking via what other people tell them to think. So, watch my video and enjoy the chance to think for yourself.
Now, I'm not going to read the beginning of the article because it's giving one particular case and it's a very sad case. West Springs Hospital did not respond to repeated inquiries from ProPublica over a year of reporting about what actions it took to prevent future EMTALA violations. The public statements it said it was committed to providing quality care and subsequently noted that the state restored its full unconditional license at the end of 2024. Keel's son did not respond to multiple requests for comment, and we are not publishing his name. This account is based on documents and interviews with his mother. Over 90 psychiatric hospitals across the country have violated EMTALA in the past 15 years, and almost all have faced the same lack of consequences a ProPublica investigation has found. Since 2019, the HHS Inspector General has only issued 3 penalties involving violations of that law by psychiatric hospitals. Taken together, these penalties totaled $427,000. The Inspector General has levied additional fines against medical hospitals for inadequate care for patients with mental illnesses. CMS has pulled Medicare certifications and funding from a handful of psychiatric hospitals, and a number of others have shut down after officials threatened to stop paying, but those cases have been the exception. Facilities are not facing consequences for providing poor quality of care, said Morgan Shields, an assistant professor at Washington University in St. Louis, who studies quality of care that behavioral health patients receive. Market isn't punishing them, and regulators are not punishing them, Shields added. That is an excellent environment to make money. The HHS Inspector General declined to comment. For its part, CMS said West Springs was given the opportunity to correct their deficiencies and subsequently was able to demonstrate compliance. CMS has an online portal to report the violations. Widespread violations of EMTALA by psychiatric hospitals and lack of enforcement come even as American mental health crisis is reaching a fever pitch with suicide rates near record highs. Democrats in Congress say they are concerned with the budget cuts under the Trump administration may impair oversight further. Now, here's the thing. This has been going on for a while. And all of a sudden, even though Democrats have been failing to solve this problem, Trump's budget cuts will all of a sudden be detrimental. I'm tired of hearing that garbage. Uh, this is the situation. I'm going to let you read this article. I'm not going to. It lists hospitals that have done things that have got them in trouble. Basically, it ain't the cuts. It's a lack of enforcement. You get fined if you do this. You lose the ability to get certain types of government insurance if you're found. That's the punishment that you get. So cuts that why are the cuts being attributed? This is the lie that Democrats tell you. Oh, we don't do anything while the Democrats in office, but a Republican's in office, we can look good. Yeah, that's the situation on this one. Here's the situation. End of story. Here's the situation. You have government bureaucrats that will refuse to do their job. End of story. That's been the case for decades upon decades. They don't lose their job if they don't do their job. No, they get pay raises and raise up the ranks. Why? Because they're protected by the union. They're also protected by civil service rules. Think about that. There are so many layers that getting rid of these people is impossible. But let's blame Donald Trump. This is a bureaucrat issue. I'm pretty certain that Donald Trump would have no problems keeping these folks around if they were doing their job. They're not doing their job. It's been proven because this report is not from this year alone. This has been going on for a long time. And I'm getting tired of hearing, oh, Donald Trump this, Donald Trump that, cuts. Oh, they're cutting the government. The government was failing us without it. These people, there are people that are dying because of how bad these bureaucrats don't do their job. Now, it's either the people with the mental health issues or people that are victims of those with mental health issues. That's the problem here. It doesn't just affect the person with mental health issues. No, it affects their victims as well because unfortunately, you take a look what happened down in North Carolina in Charlotte with that young lady. You take a look at so many others that get attacked, all these trans shooters. You can't tell me that any of them were sane. For that matter, most anybody I've ever met that's transgender, even if they can function in society, you can pretty much guarantee there's some kind of mental disorder. Not every one of them, but the vast majority of them. Why? Because we're not treating people with mental disorders correctly. And it's costing people's lives. These hospitals are failing, and the government's failing because they're not enforcing the law. That's what's going on. This has been Paul, the Redneck Thinker. Y'all have a good day now. Bye. So, folks, that's the story that I wanted to bring you on this video. And I just wanted to say thank you again for coming by. Well, hit like, subscribe, comment, all that fun stuff if you don't mind. Help me out. So, y'all have a good day now.